Emily will receive the question. Is there anyone in the audience who has a question for Emily? I have some prepared questions and that have been submitted to me, so I will ask that. When you think about the future of Maine, what is the one most important issue to Maine citizens, and how do you intend to address it? You'll have 3 minutes to respond, and then Troy will be given 1 minute to respond to that.
Thank you. Well, there's no question that the #1 issue on the campaign trail for the past year has been the economy in Maine. No question. And so when I think about taking action on Maine's economy, to get the economy moving, to give more opportunity for Maine people, I think there really is no one thing. There's no magic wand you can wave. You have to approach it from many different directions. So for me, it starts with raising the minimum wage, equal pay for equal work, investing in education, and specifically working to lower the student debt by investing in Pell Grants and working to pull back on the federal government being in the loan business for schools. I think it's more important to get back to focusing on targeted relief for working families, for young people across the state of Maine who want to start their careers after college. And I think at the same time, we need to be investing in infrastructure. And no matter which county I've been in over the past 12 months running this race, issues of broadband, cell phone service, roads, bridges, airports, ferries, ports, that foundation that the federal government has an important role to play in building really is what I believe will make the difference for us to grow the economy across the 2nd districts. And so when I think about the #1 thing, looking at the future, there is no one thing, but everything gets run through the priority of how do we grow Maine's economy, how do we get that economy moving across the 2nd district.
Troy, response to that.
Well, I certainly agree with probably everything that Senator Cain just said, but I think it's definitely a mentality. You know, in this race, I've been said to want to bring the country back 50 years. I don't agree with that on a lot of ways, but I do think that 50 years ago, you know, workers in this country felt a lot more secure in what they were doing. We had, you know, thriving industry in this state. We had mills. And I think that it's time that we quit worrying about, you know, making compromises with the Tea Party in Washington, quit worrying about giving breaks to Wall Street Democrats, and start refocusing on, you know, the mainstream people, the people that actually have driven this economy, and start giving tax breaks to those type of people. Start creating incentives to put down roots here in Maine and start jobs here in Maine. Not worrying about trying to offshore, get jobs out of here, things like NAFTA, Trans-Pacific. Those are all things that have killed this economy and killed this country. And I think that, you know, going back to having a real focus on making sure that these businesses that are fair and want to do good things in this country get the incentives is what we need to do, instead of worrying about you know, like I said, Wall Street getting everything that they have over the last, you know, 10, 15 years.
Thank you. Second question to Troy. Anyone here want to ask a question to Troy?
Is it possible, Mr. Moderator, to ask a question of both candidates?
Yes.
I have a question. I just would be interested in each of you. Hi, Troy.
Hi, Terry.
Hi, Terry.
If you would let us know how you feel about the proposed East-West Highway, which impacts the 2nd district and it's a potential infrastructure project, and whether or not that's something that's a viable option that you would support in terms of the economy.
And if both candidates are asked the same question, they will each get 3 minutes to respond. Troy?
I don't think I need 3 minutes. I don't support the East-West Highway. I haven't. I won't. I think that you know, we have a lot of infrastructure in the state that, you know, we could do upgrades on and make better. In my opinion, the East-West Highway is just going to be a shorter way for Canadians to travel through the state and not actually do anything that's productive for it. So I haven't supported, and you know, I've been very clear that I'm not going to support it.
And for me, the answer is simply, I don't see how it happens with the way things currently are. I mean, I've been watching it carefully because all the proposals would come directly across my Senate district in Penobscot County. And as I've met with communities that could potentially be impacted, every one of them says, but how do we know? When is it coming? Where is it going to be? Are there going to be exits? Is it going to help us? who's it going to actually connect to some of the points that Senator Jackson made? So I think where it stands now, I just don't see how it goes. I'm worried about the impact on the Route 2 corridor and the businesses along that route. It's a road that I've spent a lot of time on, particularly since being in the campaign. And so I think where I am right now, I just don't see how it possibly moves forward.
Thank you, Emily. Another question for Emily, or both candidates, who'd like. Okay, I will go back to the prepared question. What is your position on health care, and in particular the Affordable Care Act?
Is that to me first?
That is to you.
Okay, great. I think the Affordable Care Act has been an important step forward. I'm not interested in going back to the way it was before. Because before, you could be kicked off of your insurance because of pre-existing conditions. Health insurance companies got to make your healthcare decisions. 18-year-olds losing access to coverage just because they turned 18 and not because their parents didn't want to keep them on their plans. We can't go back to that time. I've been encouraged campaigning during the rollout of the website in the fall was pretty interesting because 6 months ago, traveling around, heard time and time again, this is a mess, I'm so concerned. But now, almost everybody knows somebody who's gotten insurance through the exchange. I know a woman who didn't have any health care. She actually lost her health care in January because of the governor's refusal to expand Medicaid. She has gone through a tough few months, and just last week, or 2 weeks ago, she got health care for $28 a month that will cover her prescriptions. That's transformative for her life. So for me, I want to go to Washington to work on improving the Affordable Care Act, to make sure that it's affordable for small businesses, that they can actually extend that health care benefit to employees, that it's affordable for families who have no other option, and particularly watching the rates. And I know there'll be proposed rates coming out in the next few weeks around small businesses and individuals and families. And I'm worried about that because I don't think we've done enough on the cost side of healthcare, lowering the overall cost and focusing on prevention. But I believe the Affordable Care Act is an important first step, and I want to keep working to improve it to make sure it's working for businesses and individuals.
Troy?
In the 12 years, I'm certainly known as a labor advocate, but healthcare is really my passion. I think that the Affordable Care Act, definitely, I don't want to see it go away. I think what you have with the Affordable Care Act is what happens when Democrats try and compromise. It isn't what it should be. It needs to be strengthened, the law, but it is the law of the land, and I support it. I think we need to fix it because it didn't go far enough. I would support universal health care. I've said this, I don't want to have a Sarah Palin moment, but I live in St. John Valley. I actually have a Fort Kent office, and I can look right into Clare and Brunswick and see people running around that have national health care, and they don't complain about their health care system. And they're right there. They're only 1,000 feet away from me, and it truly is a dividing line. Something that, in my time, I'm on my third pacemaker now, and I know that how lucky I was to be elected to get government-sponsored health care. And everyone knows that I've said it time and time again, it's an embarrassment. It's something that I can't stand to go back and look at my constituents in the face, that they don't have health care. And I was lucky enough that they voted for me is the only reason why I have health care. That's something that makes me sick to my stomach, and it's a real problem in this country, and something that I think everyone that goes to Congress that doesn't support this should be ashamed of himself. I know I'm ashamed of myself right now that we don't have a better plan.
Thank you. Questions from the audience? Yes, ma'am.
Monday is Memorial Day, so I want to ask what you think are the top issues affecting our veterans and supporting them. Thank you.
Troy, that's to you.
Well, I think our top issues with the veterans is a lot like other things, is that, in this country we have a real problem of making commitments and then not following through on them. And with our veterans, I think that's, one of the absolute worst things. I mean, you ask people, men and women, to go to war, go fight for our freedoms, protect people like myself and my children. And then if something happens to them, when they come back, we have things like, what we have right now, people waiting for services and not getting the health care they need and deserve. And to me, that's an issue that, again, is something that should never be. When you make those commitments, you have to follow through on them, and especially in that regard. I think Senator Sanders said it very well this week. If you're not going to follow through on your commitments, then don't go to war. It's as simple as that. And so when you ask people to make the ultimate sacrifice, by defending you, then you have to make sure that they get those services that they need when they come back. And we haven't been doing that as well as we should. This is a race that I'm sure myself and Senator Cain both feel Congressman Mitchell has done a lot for veterans, and it's big shoes to fill in that regard. But I don't think you really can ever do enough for men and women that's been in the service, because that really is something that I have to worry about my two sons at night, what they're doing, where they are. But to have children that are, men and women that are over there and wonder about what's happening to them is something that I can't really fathom what it must be like for parents and for sons and daughters that have mothers, fathers over there. So this is really a core issue that again, there's just no room for not following through on those commitments.
Emily?
Thank you. Certainly, Senator Jackson said, I'd like to say Congressman Michaud leaves behind a big pair of New Balance sneakers when it comes to veterans issues in our state. And I was once taught that when a member of Congress votes to send someone into harm's way, they are taking a vote to take care of that person for the rest of their lives, them and their families. And so when we think about support for veterans, it's embarrassing what's been in the news this week with the long waits and people dying because of us not doing our job and responding and making sure people get access to the benefits that they deserve. But I think support for veterans in Maine, where we have such a large number of amazing veterans in our state, it's absolutely healthcare and access to those benefits in rural places, like Congressman Michaud has spent so much time and energy doing. But it's also about making sure there's opportunity for younger veterans when they return from service, for employment, for education, for training. Mentioning it earlier, but again, the GI Bill, something that has opened doors for completely amazing lives for people for generations. I'm the granddaughter of two World War II veterans. My uncle served in Vietnam, and two of my cousins served in Afghanistan. I take these issues very seriously and look forward to continuing the work that Congressman Michaud has done.
Thank you. Other questions from the audience? Hearing none, I'll move on.
There's one.
I'm sorry. Yes.
Emily, do you support tax cuts for the wealthy?
Thank you for the question. I do not, as a rule, support tax cuts for the wealthy. And in fact, the budget referenced by Senator Jackson earlier, which I voted for, included tax cuts that I publicly stated at the time, was even quoted in the paper as saying I hated them. But that was a terrible time. That was the worst budget I'd ever seen in my 10 years there, having worked on budgets. And I know what we protected in that. I know what we protected in that budget. 28,000 people were able to keep their health care for 3 more years because we stayed at the table. Prescription drugs for the elderly, the Drugs for the Elderly program was protected completely intact because of that negotiation. We were able to make sure that nursing homes didn't close. And we were able to, even in those tax cuts, we were able to sneak in things that were good for working people, like helping fishermen with the price of fuel. And there are so many things that were worth staying at the table for. I think most of all, even though it was the most difficult portion of that budget, was the work around pensions. Because I know if we didn't stay at the table, Bruce Poliquin and Paul LePage would have made those decisions. And that was unacceptable. There's no question that was a very difficult budget. I believe the alternative was much worse. And I'm glad to have been at the table for these past 2 years since then, working to push back and restore some of the things that were cut in that original budget. Thank you for the question.
Roy?
Well, it's very clear. We didn't need to pass that budget because of the way that Maine's law works. We were in a two-thirds budget system, and Republicans needed us at that point. They needed Democrats to come along, and I think that was a failure in leadership in that. This was a chance for Democrats to stand up and push back and say, no, we're not going to give tax cuts to the rich. This is the type of thing that has ruined this economy already. We've seen it nationally with Wall Street, and we don't need to do this now. And we certainly don't need to go after teachers and state workers' pensions. That was, in my opinion, a time some of us were willing to say no and fight for that. Unfortunately, we couldn't get enough Democrats to actually push back. And that's what I'm saying about this race. You know, going into this, that we're going to be in the minority, whoever wins this seat in Washington. And so I think it's even more important in the minority to fight against the Republicans' constant attack on workers' rights. And this was one of those. And I don't believe that there's any room to say, well, I did it then, but I won't do it now as far as going to Washington. You know that that was a period, we've been here, each of us over 10 years, and you know the budget system very well. And that was a time when they needed a 2/3 vote, and Democrats should have had the backbone to say no on that issue. And we can't get that back. You know, they've got those tax cuts. They've made a $1.5 billion raid on the pension system. We're never going to be able to restore that. But the time was to push back then and say no, and I just think that that was something that, you know, I can't face people that I would do something like that to.
Thank you. Another question for Troy. Yes, ma'am.
It's the both of them.
I'm sorry?
It's the both of them.
We'll just start with Troy. That's fine.
As a representative, back in 2013, we passed legislation combating Lyme disease. And for me, that was a very passionate bill that I strongly advocated for. I know there are some medical issues, underlying medical issues with this, you know, with Lyme disease. Can you tell me where you both stand with the issues of insurance with combating Lyme disease?
Sure.
Well, absolutely. I mean, where I'm from, you know, we haven't had the problems that other parts of the state have had as of yet with Lyme disease, but we will. And we're seeing more and more retreat towards North Maine. But like I said, with all the relationships I've made with people in Oxford County and come to understand it more and more, it's a serious dilemma that's happening in this country, and something that is really hard to believe, you know, where we actually stand in this regard. So the legislation, obviously, Representative Briggs, I believe you put it in, was a very contentious thing. I didn't understand why so many people were pushing back against something that made such sense to me. You know, like I said, with my heart condition, I've been tested 4 separate times for Lyme disease to see if that's what actually caused it. And at no time was I ever told, after getting the negative test, that, well, these tests may not be accurate. And so every time I thought, well, I don't have Lyme disease, and that was it. And to find out that you know, a lot of this testing doesn't work, some people after having the test actually do have Lyme disease, I thought it was appropriate for us to ask medical staff to mention that whenever they're doing their exam, that, you know, this don't actually mean that you don't have Lyme disease. And that bill, as you know, and Senator Patrick knows, got very contentious. People talked about getting in the way of doctor-patient relationships. I didn't see it as that. I saw it as a real serious concern, something that people are you know, really getting serious illness about, and should know everything about you know, what their health care is in this regard. And so I supported it. I think that you know, having those conversations with your doctor and making sure your doctor lets you know that these tests aren't always accurate, you know, don't stop here, is important. And I support making sure that insurance companies cover these type of testing and do everything they can to help people that are found to be having Lyme disease. And many of the insurance companies don't want to cover this type of affliction. So it's a serious concern. It's a real problem in the state, and something that we need to make sure that people are aware of, and insurance companies aren't able to wriggle out of, and doctors explain to people all of the issues that surround Lyme disease and Lyme testing.
Thank you, Troy. Emily?
Thank you, and Representative Briggs, thank you for all of your work on Lyme disease. I think it's amazing how much now everybody, again, knows somebody who's got Lyme disease. For me, it was really brought home in 2012. I was knocking on doors for my Senate race in Lincoln, and knocked on the door as you do, and this woman answered the door, and I got to talking, and she was a physician who had to ultimately leave her job as a doctor in rural Maine because she couldn't work anymore because of Lyme disease. And Lyme disease didn't used to exist in Maine, and that gets into a whole we could really get into climate change if you want to talk about what's causing the spread of Lyme throughout the Northeast now, where it never used to be a problem. I absolutely think insurance companies have to cover it. We need to make sure we get patients informed. I think the ultimate version of that bill included information from a lab, as I recall, about different kinds of testing. I'd have to go back and look, but I think it's important that we keep pushing. Absolutely, it should be covered, and I think it's a very scary reality that in Maine we're now going to have to deal with. And I know there's a lot of work going on across the state to educate people about what to look for. Sometimes pictures are not fun to look at when they show them on the news about how to find a tick, how to take it off, how to help your dogs or your cats. And I think the best thing we can do is keep talking about it and keep raising awareness and taking action. So thank you so much for your work.